Welcome. Thank you for joining Consumers Doctors channel. We've been talking a lot about freedom in healthcare. Yes, folks, freedom in healthcare. Americans believe in free enterprise, they believe in freedom, they believe this country is based on free enterprise and freedom. Tell me who would like to see so-called your health is being managed by your government. I have no idea what the implications are. I'm sure it is being managed by the government in other countries, but believe me, folks, it's going to be. We can't even manage a postal service. Now you're going to manage my health? Are you kidding me? No way. I want freedom, total freedom from healthcare. I believe we have a path towards that. I don't know why people don't look into it, embrace it. I'm sure, people in the Democratic Party and independents, the President Biden is going to be our next president. Good luck. Because I believe fundamentally Americans believe in freedom, especially in healthcare. When it comes to healthcare, they don't want to be told where to go, what to do, how much to pay, and what kind of are they covering your pre-existing conditions, they are covering this. Oh, come on, folks, you don't want that. We want to be free, and there's a path to it. That path is called personalized healthcare, folks. Personalized. I can't simplify anything more than that. Personalized healthcare. It's like any other insurance, what we have been noticed. Insurance is a big industry in this country. When you're talking about $3.7 trillion and 17.8 of the national GDP, there are going to be lobbyists. There are going to be people, there are lobbyists everywhere trying to protect their businesses. I understand all that logic, folks, but you Americans, we need to. I come from a country where we believed in, India believes in freedom. I know. Again, actually India does a better job in taking care of the health rather than what we have. This healthcare system in the United States is so dysfunctional. I can't even imagine what we are going through. I cannot even imagine what India spends 1.5% of the GDP, and their economy is 20 times smaller than US. Come on. Can you imagine? They have, I don't like the system what they have, but what I'm suggesting is there is a path towards freedom in this country, which is achievable. If you are looking health as an asset, I'm sure all of you agree, this health is your asset. Folks, this is your asset. Why can't you look into that? Your car is an asset. If you have to drive, you have to have an insurance. You have to have a home, you have to have insurance. And why not in health? This is what amazes me. Why does health is so different from food industry? All these businesses. I like business aspect of Amazon getting into the grocery chain, Google getting into the technology. Google has to get into medicine. Amazon has to get involved with healthcare. There are trillions of dollars. America is wasting. Yes, I'm not kidding. Yes, it is wasted. Year after year, year after year, year after year. That money is being wasted away. God only knows where it goes. But I'm telling you, it's probably going into the Wall Street somewhere. And I don't blame anybody here. I'm not blaming anyone. This is not a blame game. This is something with it's personal for me. I want personal health care, insurance, personalized so-called health insurance personalized. Today I became a volunteer and joined in the COVID vaccine research trial. I have no problem enrolling. I volunteered, we'll see if they select me, but I want to do something good for before I'm gone. I want to do something good. I would like to see everybody happy, everybody be free from the healthcare shackles, so-called shackles. Right now, you know, every time they come up with, no, we used to have about what 45 million uninsured, now there's 28 million. Why can't they focus on that group, address that, rather than passing laws, passing this, trying to change the entire system? What we have, we need to slowly work towards personalized healthcare system, folks. So-called HDHP. I renamed it. It's not I don't want to. Once I say deductible, I say, oh, it is. People don't like that deductible part. I renamed it. Health disclosure. Healthy premium. You disclose your health, you get a better premium. I was just Googling today, what is my HDHP insurance coverage will be. If I'm a 30, 40 years old, you know what? It starts at $156, folks. Again, it's the starting. And the beauty about it is, whatever is you're saving, put $300. You know, you're talking about 150 bucks. You're spending $450 on your insurance, folks. But $300, it goes into your account. I'm telling you, it is Health Solutions Advantage. HSA. I'm going to keep on saying the same old thing. You know, people probably might think I'm crazy. I want everybody to have savings accounts. Health Solutions Advantage, which is an HSA. You can set it up easily. You can go to Fidelity, you can go to any brokerage. They have HSA accounts. You can open an account. This is my job as a consumer's doctor for my foremost organization. Is a non-profit organization. I want to help people. I want to help people with 60, 70 million Americans. They already have a private, but they don't have the right kind of insurance, folks. Employer subsidized insurance need to be changed to health disclosure, healthy premium accounts like HDHP account. Employer is contributing to the payment, and they save the money more than anything else. Employers save big time, but they need to, in that process, can you imagine if they are paying only $156 for an employee? Right now they're paying $14,000 to $16,000, and that money, year after year, we don't see it. We never see it. That's what I want to change it. Make the HDHP available for all Americans, especially people who are uninsured, underinsured, no insurance. You know, these 28 million Americans who are not insured, who don't have insurance, and you have an additional, I'm sure, about 15, 20 million illegal Americans. There's a way to do it done. We don't, the hospitals, these premiums, what we have, traditional insurance premium, it's a risk pool concept, needs to be changed to segmentation concept. Risk needs to be segmented, folks. It has got to be segmented. You and me and everybody else, why should I be paying for people who have diabetes and hypertension? And why should I be paying for the uninsured? Your premiums are based on that. Yes, your premiums are based on uncompensated care in the hospitals. Hospitals are taking the burden. Doctors are there. And nobody wants to take care of the Medicaid. Believe me, Medicaid needs to be scrapped, folks. Medicaid is useless. None of the doctors want to take Medicaid. Nobody wants to treat Medicaid patients. They are being neglected. Yes, they are being neglected. Why can't we realize that Medicaid, Medi-Cal is, even though it's managed by the states, It's being neglected. Yeah. These, especially people who really the healthcare the most, they're joining this Medicaid, and the the cost is going up by not getting the care what they need. What they need is certificate of guaranteed coverage, folks. You don't want Medicaid. Provide public, even I thought the Democrats believe in public private partnership. I believe. Who's that Chicago mayor, Rahm Emanuel? Chicago mayor, he set up the best public private partnership. Why can't we follow in his tradition? Why can't we do the public private partnership and create a health review board? There's no expense to the government, folks. There's no expense involved. There's no expense. Zero cost. Health review board. They're all representing public, private individuals. It's a partnership. You have a board, and people who really don't have the health insurance, they will look into it, their economic status, wherever they stand. Once they provide the health certificate of guaranteed coverage, health insurance companies will love to take care of them, folks. They want more business. Why can't we realize and help them get the certificate, and also help them? Especially 15% of the American populations are in the poor, 15 to 20% in the poor. I've been saying all along, the least the government can do, give them the life insurance for 100,000, all 15% of the Americans who deserve it, so they can climb up the ladder. Why can't Democrats focus on people, helping people? Every time I see, here I'm in Long Beach, I see people on the streets with their cars, golf carts, with their belongings. It's so tragic, man. I can't imagine if I'm in America or I'm in India. I cannot imagine government is not able to take care, and they want to punish the rest of the folks, which is not right. Focus your attention to the people who need the most. Is that a difficult thing to do? We need help from the bottom 15 to 20%. Fine, whatever you want to do, you want to raise whatever the tax. If it goes for a good cause, I'll be the first one to do it. I'm self-employed. I'm retired. I'm a urologist. I own a senior facility. I have no problem. I love to take care of the seniors. This is where I've been in business. So what I want to see is help the people who need the most. That's what we need. We need a lot of help, especially for those 28 million Americans. Focus on them, not go after. This so-called Affordable Care Act, we have reaped the benefits. Those 5 elements we have, we need to embrace them. We need to guaranteed coverage, coverage for pre-existing, catastrophic. We all need that. So let's implement, let's have that incorporated into personalized healthcare, so-called health insurance personalized. Health insurance personalized is nothing but a regular card, folks, which is an health disclosure, healthy pricing card, and you pay as you go. It is linked to your health savings. If you go to see a doctor, if you go and see to the emergency room or urgent care, they need to be transparent. They have to be transparent. I need to know what I'm paying for. They tell me, I don't want a surprise medical billing. I don't like the billing. Believe me, I've seen it for the last 35 years. The healthcare billing, how it works. There are 9,000 billing companies, folks. Do we really need all these? And they're being trained like nurses. They're being trained to how to bill the insurance companies. They're being trained to be brainwashed into billing more. Come on, do we need all that? If I'm getting into the hospital, if I'm going for an appendectomy, I need to know the cost. And if I have a certificate of guaranteed coverage, I shouldn't have a problem. If I have a HTHP account, I need to know how much I'm responsible for it. If it costs about $6, $7, $8,000, yes, tell me. If I am going for a surgery, what is my cost? I will shop around. I'll go to a facility where they can do it for 4,000. I'll go to a place where it's 3,000. Anywhere in US, even if it comes to the, you know, this is my health. I don't want to take the risk, but I want to make a best choice for my health. Obviously, when you're paying for it, obviously you take all precautions and select the best doctor, best surgeon, best hospital. You don't mind paying more for your health. Is that a bad situation to be in for the majority of the Americans? You have 160, 170 million blue collar workers. You have 70 million, 65 to 70 million on government subsidized Medicare program. Another 15, 20 million self-employed, so-called small businesses. Another maybe 10, 20 million, you may have on veterans. All these people, what they need is not a traditional insurance, folks. What they need is HGHP accounts. Even Medicare. I don't like the HHS, whatever, Health and Human Services, and CMS, if they're listening. Hey, don't pump the money into the intermediaries, man. You guys are pouring the money into the intermediaries. You're just taking off your responsibility and putting the money in the wrong place. Here, that's my sweat and blood, man. You're giving the money to the stupid intermediary organizations, and you're raising the cost, and you're robbing my health. Medicare, I'm telling you, Medicare, you're robbing my health. I want to take my response. Give me that $1,200. I will provide the best care for myself. I don't need intermediaries telling me where to go, what to do, co-pays, deductibles, denials. Come on, folks. We don't need all that bullshit. We need to straighten up, man. We need to straighten up. HHS, who are there in Washington, if they're listening, AARP, especially AARP, needs to demand that $1,200 to all these 65, 70 million Americans. Give that money back to us so we take care of our own health, and we will save the money into this health savings. I can put money aside into my own health savings. I don't need government to tell me, where to put. That's my money. That's our money. Why are they giving it to the intermediaries? And very first thing they get the contract, look at the bombardment of Medicare, Advantage, Medicare, this, they want the government money. Basically, what they're doing is you're literally signing your life away to these so-called intermediaries by signing that one piece of document. They're entitled to your $1,200, folks. Don't sign anything. Just demand that $1,200 from the HHS or CMS, who are the organization controls your Medicare healthcare dollars. Give that money back to us. Thank you for joining again. If you do like this channel, subscribe, share, and hit the bell. Hit that bell. I couldn't get onto the morning coffee this morning, and I'll be back again every Monday morning at 6:30. Coffee with Consumers Doctor. Thank you for joining. I love you guys. I admire Americans. I am begging all Americans to think seriously. This is the time to be independent. I see these big rallies in Washington, D.C. These are the true freedom fighters. They want independence. They don't want government intrusion into personal lives. They have no business getting into the personal lives. They have no business to be in. If you do like this channel, again, subscribe, share, and hit that bell. We'll see you next time. This is Consumers Doctor. I admire you guys. Keep working hard. Be independent, man. Be independent. Thanks again.